Good evening. I'm Brooke Edwards. I'm one of the urologists here at the urology group, and I'm excited that you are able to join us tonight for a conversation about erectile dysfunction, focusing on men's wellness. So I appreciate taking your time tonight and joining me. So hopefully this will be a good conversation for you all to get a little more insight into your health, what's going on with sexual wellness, and erectile dysfunction in general. So hopefully it'll be informative and see as it a positive. So I have up a chat. So if you have questions along the way, I'll try to pay attention to them. If I miss it, I'll just try to circle back at the end and answer questions that you guys have. But we'll get started, okay? All right. So again, I'm Dr. Brooke Edwards. I have been a urologist here for 10 years. I also serve as our chief medical officer for probably the last 7 years or so. I see majority of my patients in the Northern Kentucky office. I work here though in Norwood, where I'm located tonight, and operate at our surgery center here in Norwood. I have been taking care of men's sexual health for the last several years since I started here. It's been one of my specialties and one of my interests. But I also do male urethral reconstruction and incontinence surgeries and robotic surgeries for oncology. All right, so erectile dysfunction, what is it? Well, I think a lot of people think that ED is something either they have or they don't. And it's black or white, and it's so not. I like to think of it as more erectile function and what is your level of function. Is it the same level that you had when you were 20 and erections were great and they lasted forever and there wasn't a question or concern and there was no stress related to it, all the way up to not being able to get an erection at all. But in the middle is where most people fall. So maybe your quality of erection is just not quite as where it was before. Maybe you don't feel like you have the same amount of rigidity, or maybe you don't have any problems getting it, but it just doesn't maintain as long as it used to. So ED is all of those things. For anyone that feels that their quality is not as good as it used to be, you can say you have some level of ED because it is just so common. All right, and how common is it? Well, approximately 1 in 5 American men have some form of ED if they're over the age of 20. More than half over the age of 50 have some degree of ED. If you take a 40-year-old, approximately 40% of them have ED, and if you're 70 or above, over 70%. I feel like it's very common that I'll have someone in their 70s in my office and say, am I the only one? Is this, this doesn't happen very often, does it? And I kind of look around, I'm like, really? If you're over the age of 70, the majority of your friends are having ED of some degree. So you are definitely not the only one. And approximately 30 million American men are affected with ED. So it is extremely common. All right. So before we talk about the whys and hows and how to get it better, I think the best thing is to understand what erection really is and how it occurs. And it's really just about a mechanical thing that happens to get blood flow in and how to maintain the blood flow in before it comes out. So what happens? So you need a stimulation, whether that is a movie or your wife or your girlfriend or just a thought, something that needs to come around that causes some arousal that's going to cause a stimulation. It's a biochemical occurrence that causes the nerve to fire. When that happens, it makes muscles work that relax the arteries. The arteries are where your blood flow comes in. So again, a nerve fires, it relaxes the arteries so blood can come in. Blood comes in, the penis gets engorged, it gets rigid. And in doing so, when you look at your screen, these red vessels are the arteries where blood flow is coming in. Once it gets really full, it compresses the blue vessels. Those are the veins. And when those get compressed, the blood can't leave. So then you've got a full erection at that point. So it's as simple as that, although in our body, we know it's not that simple. So what really causes ED? So 70% of the time, it's very boring things that we don't really like to blame it on, other than just general health concerns. So vascular disease is what I tell, a lot of patients, the concern. So if you have heart disease, heart problems, high blood pressure issues, anything like that, then you likely have some level of vascular disease. It could be diabetes. It could be being overweight or smoking. So it's the boring general health concerns that causes the majority of ED for most men. The other 30% are other things such as medications, prior surgeries, maybe low testosterone, depression, anxiety, radiation, different histories of medical things that we can talk about. So what can you do? Well, I can tell everyone one answer, and it's basically be healthier, right? It's a boring answer again, but anything that helps your heart is going to help with improving quality of erections. So that's improving your diet, what you're taking in, exercise, getting your heart pumping. Any weight loss, unless you're underweight, is typically more beneficial for your vessels, your blood pressure, and your erections. Limiting alcohol intake, smoking, again, substances that are bad for us do not help the quality of our erections. Stress and anxiety definitely doesn't help. And if you're not getting enough sleep, then we don't handle the stressors in our life as well, and our erection quality will not be near as good. All right. What are some of the urologic issues, though, that are causes for ED or related to them? The first three that we'll talk about is low testosterone. It's pretty common. 4 in 10 men over the age of 45 will have some degree of low testosterone. And it gets more of an issue as you get older, becomes more common. Peyronie's disease we'll get into, but again, that's where you get a curvature, typically the traditional curvature of your erection, that affects about 10% of men over the age of 50. It becomes, again, more common with age. And because people don't like to talk about it, and it's been fairly something that physicians don't know a lot about, and it's not out in the marketing until just recently, people will just go undiagnosed because they don't really know it's a thing. And then prostate cancer. Cancer itself won't cause ED, but a lot of times the treatments can, and we'll get into that. All right, so the first one, low testosterone. So your body naturally started producing testosterone at a very young age, and it became more significant when you went through puberty and in your teens and 20s. Over time, though, the amount of testosterone in your body is normal to slowly decrease. Sometimes it decreases at a faster rate than we expect it to, and it can have effects on the quality of erections that you have. If you're overweight, or if you have diabetes, high cholesterol, high blood pressure, then low testosterone can be even more common. So what are some signs that you may have low T? It could be that you have low energy levels or fatigue. You get home from work and you really don't feel like doing anything afterwards. I think that's pretty common. So that's kind of hard to judge whether that's something that is just normal life and stress, or is it low testosterone? So I think it's really important to think about, what was it like a few years ago? Do I feel the same as I did then? Decreased muscle or strength. So if you feel like you're not quite getting the gains in the same level of activities that you used to do, then it's something to think about. Increased body fat. So if you've gained some weight around the middle, that can be a sign that your testosterone's lower, especially if you, again, are doing the same activities that you've been doing for a long time. So it doesn't seem like it's jiving with the amount of exercise or what you're eating. If you have loss of hair loss, different, and I don't just mean on your head, I mean on your body. So if you feel like you're not coming in with the beard as much as you used to, or your legs don't have as much hair on them, or your chest, then that could be a sign that your testosterone's lower. In more extreme situations, you can notice some hot flashes, just like women complain during perimenopausal time that they get really hot and they suddenly sweat. Men can do the same thing. And then the last one is libido, or your drive for interest in sex, your sexual drive. That can be another one. Mentally or emotionally, there's also some symptoms. So you may feel somewhat depressed, sad, blue, less motivated to do things, not as interested in doing the activities that you used to do. Maybe you just aren't interested in going to the gym, and you used to have a drive to get up in the morning and go. Maybe not feeling as confident about things at work or at home, or just not as excited about it. And also the big one that some people start noticing is memory, or the ability to stay focused on a task. I think that's a common one that people aren't associating with low testosterone, and they are talking to their family docs and PCPs, but it can be a big one. With testosterone replacement, a lot of times people will feel that they have more of an acuity for memory and thinking. So what are treatments? So treatments come in many, many different ways, all the way from gels and solutions that you just put on your skin to pills that we take. There's nasal sprays. There's adhesive patches that you would change every so often. We could put pellets under the skin, or we can do injections. Testosterone kind of comes in all different ways. It just depends on cost, how well you absorb it, what you will stay consistent with and remember to take. So those are all options. We have a low testosterone clinic here at the urology group that makes it much more convenient. I think a lot of my patients that are on testosterone replacement, the hardest thing is to remember to get your labs, to get your refills, and get your visits that you need to do to maintain those prescriptions. The one thing that's kind of annoying about testosterone is it is a controlled substance. So there are rules that providers have to follow very tightly. So it requires routine lab work and visits with a provider. For us, we do a lot of telehealth visits with our patients. So we try to make it as easy as possible so that, we let you know when your prescription's ready, when your labs are due, when you need to come in for your visit so that you don't run out of your prescription. All right. Another cause, Peyronie's disease. All right, so that's where I said where people somewhat notice a curve. And not everybody may have a curve, but they may notice a bump on their erection. They may not notice it when they're flaccid, but when they're actually rigid, you may notice it. The start of Peyronie's disease for some people is that it can cause some discomfort when you get an erection, and that can last for several months for some people. So it comes in different forms, but it's not the same for anyone, but the traditional one that people talk about is the curve. There have been commercials lately, as I mentioned earlier, that traditionally Peyronie's disease wasn't anything that was marketed or talked to with patients. But now some different industries have started talking about it. You'll see commercials now. They're talking about I've seen a squash, an eggplant, a banana, all these different shapes, but they're all basically curved, and that's the point. Again, Peyronie's disease occurs more commonly as you get older. I want to make sure I hit everything. It can be associated with erectile dysfunction. That's why we're talking about it tonight. A lot of the times, I think what happens is when you get that curve, you still get blood flow in. It's not stopping that, but it doesn't allow for the veins to get closed off. Like I mentioned in that early slide, when the blood flow comes in and it compresses the veins on the outside so no blood flow leaves. I think when you get curvature or bends, it doesn't stop that blood flow out. So it's very difficult to maintain erections for some people. Others, they have a curve. It doesn't affect their erections, but just one of those things that's good to know. So what's treatment? We do have a couple different options really with this one. One is a RestoreX, which is a traction device that stretches it. At the top, you'll see here that basically there's a scar in the outside layer of what we call the erectile bodies. When that scar happens, it doesn't stretch. So the bottom part, the sides, everything else stretches, but where that scar is, it doesn't. And that's why you kind of get this rubber band effect. So for a full erection, it would be straight, but when you have a scar at the top, it tends to do this. If you could just take the scar out, it would go straight again. It's just not that easy, unfortunately. So we try a RestoreX device, which will help traction and pull it. You do that at home. So that's one reason why a lot of patients like it, because they're not committing to anything coming into the office. Another one is called XIAFLEX. It's an injection that we put into the scar. and it has a medication that's an enzyme that breaks down the collagen or scar tissue, and it softens it, and then that way we can start straightening it out with time. The other option is surgery. So basically going in and cutting out the scar and putting in a different tissue. We do that for the more extreme cases. The other option is going in and plicating or darting the opposite side of the curve, which will straighten it out. So that's an option that we probably do more commonly. And then the last one would be a penile prosthesis or implant, which we're going to talk more thoroughly here in a little bit about. But basically, it's the idea of putting an inflatable device in that takes care of getting an erection, but it also can straighten out that curve. So for my patients that come in with Peyronie's disease that are curved, and they're struggling pretty significantly with the ability to get an erection, I say, you know what, you may just want to take care of both things with a penile prosthesis and having an implant put in. So we talk about that. I see a question came up that's asking, can an enlarged prostate be the cause of ED? Would treatment for an enlarged prostate also treat ED? I will tell you, it shouldn't directly cause it. Having what we call BPH or an enlarged prostate does not decrease blood flow to the erection, so it shouldn't. Now, I've had some patients improve over time, but I think after they've had BPH treatment, but I think a lot of the times that's more because they are sleeping better, urinating better. Quality of life in general has increased. So maybe they're exercising more and the quality of probably their testosterone levels and blood flow and all the above gets better. I've also had patients that have had issues with ejaculation and they're not noticing any fluid come out. So we call it a dry ejaculation. Once they had their BPH treatment done, sometimes that has improved. Now, understand when I say that, there are treatments for BPH that can do the opposite and make someone not be able to have fluid come out during ejaculation. So it's not really a known treatment, but I've seen it happen. It just kind of depends on what the situation is for the patient. All right, so prostate cancer, that was the third thing that I said that was urologically related, but and causes ED. So again, ED is not caused by prostate cancer itself, but when we treat prostate cancer, there is a risk of ED when we offer radiation treatment. This says brachytherapy, which is basically radiation that's delivered with little seeds that are put in the prostate. We can do surgery to remove the prostate. Sometimes we give medication that decreases testosterone. So I just said high testosterone gives you better erection quality at times. So decreasing it would decrease your quality of erections. Cryotherapy is where we freeze the prostate gland. Proton beam is another version of, it's similar to radiation, just a little bit different. And then HIFU is high frequency ultrasound. So all of those things treat a cancer, trying to kill those cells. And when they do that, because the nerves are so close to the prostate on the sides, sometimes the nerves are treated also in a way that we don't really want them to be treated. If someone doesn't have severe prostate cancer, often we just observe or we offer a treatment that minimizes the risk of erectile dysfunction. So just because someone has a diagnosis of prostate cancer doesn't mean that they're doomed for ED. But I think it's a really important question and discussion to have with your urologist if that's something that you're going through. Or if you've had it in the past, knowing that that can affect your treatments in the future. I think that's important to talk about. All right, so the more exciting part, what types of erectile dysfunction can be treated? Or excuse me, most types, yes, but the treatments, that's what gets everybody excited and often that's what gets you to the doctor, right? Even though everyone wants to know why, but they also want to know what can we do about it? All right, so treatments come in a variety of ways, right? So we have pills, we have vacuum erection devices, that pull blood flow in. We have ultrasound shockwave therapy. We have injections that you give yourself. And then we have implants, or I said penile prosthesis, where a device goes inside the tissue from a surgical perspective that can treat it. All right. So the first one, I'll give you some pointers on pills on medications. So why do we take them? So we're talking about Viagra, Cialis, the generic names are tadalafil and sildenafil. We take these medications because it works on those nerves that I said then causes blood flow in. So you can take these to increase the blood flow into the penis. You still need stimulation. Just because you pop the pill doesn't mean you're going to get an automatic erection. You still need the stimulation to get those nerves to help fire. It works in over 50% of men. It's not as effective for those that have poorly controlled diabetes or those that have had significant surgery on their prostate, typically for prostate cancer. When we talk about BPH surgeries and things like that, that's not necessarily the case. Often this isn't covered by insurance. Occasionally someone, TRICARE, maybe some of the military insurances will cover it, but otherwise it's typically not. So usually it's cash pay. The side effects of it is it can cause flushing and headaches. Some people notice, their face getting really red. It has the potential to cause, especially Viagra, some blue changes or haziness in your vision. I will say that's pretty uncommon. I rarely have a patient say that they notice that. Because it works to pull blood flow in. If you were to take high doses, it could cause an erection that lasts longer than desired. If it's 4 hours or more, that's what we call a priapism. And some people say, well, what's wrong with that? Unfortunately, that's also bad for the tissues. So it could cause further erectile dysfunction. So we don't want you to have an erection, especially if it's painful for 4 hours or even a little less than that. So not taking the medication not quite as directed or recommended could lead to something like that. All right, so sildenafil or Viagra, again, there's one's a generic and one's the brand name. We tell people usually to take it about 30 to 60 minutes before they want it to work. Once it kicks in, it usually lasts for about 4 hours. And the secret to this medication, because I have a lot of guys that come to me and they're like, I tried Viagra, it didn't work. And I immediately will ask, did you take it on an empty stomach? That is the one thing that a lot of times family docs and PCPs don't mention, or they forget that the urologist mentioned it. But it needs to be absorbed directly from the stomach quickly. So if you take it with food, it's not going to happen. So if you have a hamburger, or even if you don't have anything to eat, but say you have a beer or alcoholic drink, it's not going to absorb well. And so you're not going to get the benefits. If you say one pill usually works great, but I took it yesterday, it didn't work. I usually say, well, did you take it with food? Did you take it with a meal? Did you take it in a different way than you usually do? And usually the person can remember that that's what was different about it. So if you have it at home and it hasn't worked for you, just try it again on an empty stomach, 30 minutes before a meal or 2 hours after a meal. The next drug is Cialis or tadalafil. It works differently. It's very similar, but it does have its own nuances. So this one you need to take a little longer, so at least an hour before you expect it to work. But once it kicks in, it's good for about a day and a half. So I tell people if you're going out to dinner on Friday evening, take it then, and it should work through Saturday night. So a day and a half, it's good. You can take it with food. It doesn't matter because it's going to take a little longer to work anyway. They have a high dose of 20 milligrams and a low dose of 5 milligrams. And you can take the 5 milligrams daily, especially if you don't want to plan. And if you take it daily, that low dose, it'll build up in your system to the higher dose level, and you won't have to worry about the timing. So that's the one advantage of it, especially if you like a little more spontaneity and don't want to have to worry about the timing. All right, and I'll go back and answer questions. I think someone had asked about Peyronie's disease with a sideways curve. Definitely, you can have a curve up, down, left, right. For some people, you'll have two curves, and it'll actually cause a twist, so it looks odd, or they'll say it's an S shape. That's just because there happens to be two scars resulting in two curves. Someone else asked if there was an over-the-counter medication that helps with testosterone. That's a great question. I get it a lot. So it's the same for testosterone or erections. Be very, very cautious on taking the medications that are over the counter. They're not FDA regulated. So anything that's not a prescription basically has very loose quality control, and they can put just about anything on that label. So if they say this is 100% natural and it's only these two supplements that's in this drug, there's not really anyone that goes back and routinely checks that medication or that supplement to say that that's what's in there. So they can say a lot of things, but it doesn't actually isn't necessarily true, unfortunately. I wish it wasn't that way. So I tell my patients to be very, very cautious, because I've had some patients that have taken things over the counter only later to find out that they had substances in them that they really weren't allowed to take because it interacted with other medications. That's the reason why they couldn't take Viagra, for example, but the medication that they took from GNC or wherever actually had traces of Viagra in it. So they had problems with it. So there's a lot of significant side effects that can happen with some of those supplements, even though they may say they're natural or they seem pretty benign and safe, especially since it's not a prescription. We think that it's safe to take, but there are definitely side effects that can happen from those. So be cautious and talk to your physician about those. Someone's asking about the milligrams. For Viagra or sildenafil, the max dose is 100 milligrams. You can find Viagra, non-generic Viagra, at 50s and 100s. And you can take either. You can take 250s or start with 50 and work up to 100. Or you can get sildenafils that can come in 50s and 100s. But most commonly, you'll find them in 20 milligrams. And I actually like those because they tend to be the cheapest option. If you just take 5 of those versus one of the others, sometimes it's still a cost savings. And remember, I said that it's real important that it gets absorbed from the stomach. Well, if you think about it, if you take 5 little tabs, there's more surface area to those tabs and they break up and absorb quicker than one big one. So I actually like using the 20 milligram sildenafils. For Cialis, the max dose is 20 milligrams. And no, it doesn't mean Cialis isn't as strong as Viagra. That's a question I get a lot. It's just that 20 milligrams of Cialis is equivalent to 100 of Viagra. So the 20 milligrams of Cialis or tadalafil is what you want to use if you use it just as needed and you only want it occasionally. And again, you want to use it for the day and a half. If you want it in your system every day, then you want to use the 5 milligrams daily. Some people can break that in half and use 2.5. That's what you would want to talk to with your physician, but they do have the 2 different types of dosing. All right. Again, if you are on here, you're probably a patient of the urology group. If you've never talked to your physician about it, you can get your prescriptions here locally. If you're in the Norwood office, you can get them filled and picked up on the way out. If you're in the Northern Kentucky office, it's the same thing. They have the medications for ED. And if you're at a different location, they can still get them to you. They mail Viagra, Cialis every day out to patients. So it can be pretty convenient, better than, having to go to Walmart or CVS or Kroger or wherever you get your medications, since they're mailed to you. And you don't have to have it be a membership. You don't have to have a membership or a club card or use GoodRx. I know sometimes they are helpful to use GoodRx, and sometimes it's a hassle because the rules always change with GoodRx, and you never know quite if the pharmacy is going to take it or not. Although otherwise, it is very helpful. All right, so what's another option? I have things to show you now. So vacuum erection devices, we call them VEDs for that reason. Let's see if you can see this here. So they are effective in about 60 to 80% of our guys. They're very simple. I like it because there's no side effects from like a medication. You don't have to worry about that. You also don't have to keep buying it, right? So typically, sometimes insurance cover these. Sometimes they cost between $150 to $250. It kind of depends on the company that you're looking at them for. I would say if you happen to get one of these, make sure you get a medical grade. You can go to the adult bookstores or online stores, but a lot of the times there's issues with the pressure and the vacuum pressure. And I've had some patients had some issues with them, and they also tend to break and not hold up. This is pretty sturdy. So what happens is it comes with this little, it's almost like rubbery that goes around the penis, mostly just to protect your skin. And then you put this over the penis. This goes on there, and then you push this, and I can feel it's pulling the air in so that it's vacuuming basically the skin. What it's going to do is going to pull the blood flow into the penis so that you have a good erection. And then it comes with bands that you take this off, put the band around the base, and it holds the blood flow in. It's great for those, again, that are looking to avoid side effects and not want to keep spending money. And it's very, very low risk. The downside is clearly this is not the most natural thing, and it's a little cumbersome to operate and use. So for some people, it's not their favorite, but it's a good option. I think I went through how it works. All right, next option. So ultrasound wave therapy. So I'm actually tonight down in our ultrasound wave therapy suite for our patients. So I wanted to show you the device. We are excited about this. We've been offering ultrasound therapy for, oh goodness, I don't want to say 2 to 3 years at this point. We were excited to bring it in because we had a lot of patients going out and getting it from institutions that we thought maybe were not offering all the options and not preparing patients appropriately so that they had the right expectations. We think ultrasound wave therapy is great for several reasons. It's not medication, so there's not going to be side effects with it. You're not going to have interactions with other medications. It's absolutely not painful. It's not surgery. The risks on it are just so low. So we like it. So what happens? So typically you schedule an appointment to talk with one of our nurse practitioners that specializes in men's sexual health, and they'll go through all the goods and bads of the treatment. You know, if you're a good candidate, those type of things. They get you scheduled and you come in. One of our technicians will do the treatment. It's usually 6 different treatments. I tell my patients, if you're not going to commit to 6, I wouldn't do it because you're kind of wasting your time. You really want to make sure you get the benefits. We really looked into the literature and studies that they did on this over the last 10 to 15 years because it's fairly new in the last 5 to 10 years in the US and become much more popular over the last 5 years to be used because for good or bad, you don't have to be a physician or doctor to really do it. So you see it available in different men's health clinics. My concern with that is if you're not seeing a urologist or someone that specializes in men's sexual health, then a lot of the times you're only being offered a couple options and they may not be the best option for you. So you always want to try to have these conversations with someone that kind of has all their tools in the toolbox so that they can pick the one that's right for you that makes the most sense. So that was our goal when we started offering this therapy at the urology group. But as far as the details, again, no side effects. You're going to walk in and you're going to walk out just the same. So you don't need to have really any downtime from work or doing anything or activity. Like I said, it doesn't hurt. Let's see, this says talking about erection. So I think it works really well for someone that has mild to moderate ED. If you are someone that has maxed out their Viagra and it no longer works, and you've done some of our other more advanced therapies and it's not working, then I don't think this is the right thing for you. I think it would probably increase your blood flow and you get better blood flow into the penis, but it may not be enough that you're able to have sex on your own without additional treatment. So it may not be the right person. But if you are someone that takes, let's say, a small dose of Viagra, or even maybe a middle of the range dose of Viagra. If you do that and you get decent results and you're pretty happy, but you're like, I don't want to be on medications anymore, this is a great treatment for someone that's in that situation. The idea is to get them off the medication. Or maybe it used to work really well, but you've started to get to the top doses of it, and we use ultrasound therapy. It hopefully will get you back to you being able to use regular doses so that it works now. Instead of having to go on to more advanced therapies. So it works well for a large portion of our patients, but not the best if you're someone that has what I call severe ED. So let me just show this to you. This is what we call the Storrs dual lift. That's just the company. It was highly studied in Europe before it came to the U.S. We really, really like it for that reason, because there's a lot of medical studies that have been done on it showing that it works well and it doesn't have negative side effects. So I don't have this one on, but basically this would just go on the top side of the penis, down the bottom side. They do it in different areas. And they click the button and you'll hear like basically a tapping, a loud tapping. And you'll kind of feel a little bit of that tapping. It should not be uncomfortable. They sometimes will adjust the pulse rate on how fast it is, but also how strong it is to get the best result for you. That being said, if at all you feel like anything that's uncomfortable, then they just back it back down. So it's completely controllable, which is what I like about it. Let's see here. Make sure I mentioned everything for you. This is focal versus radial wave. That's the difference on what we offer versus a lot of times what you see in some of the men's health clinics, because some devices are cheaper than others and are a bigger investment. But a lot of times those are the ones, fortunately or unfortunately, that do the best job at penetrating appropriately. So looking at the studies, we picked our machine based on that, on who had the best results for the different machines. So we've been very, very happy. We've had this specific one for over a year and have been very, very happy with outcomes for patients. So I think it's a great option. It's not covered by insurance, is the one downside. One day it might be, but it's certainly not now. And if the cost is something that you can handle, then I think it's a great option because it's more natural, those type of things. I know there were some questions. Someone's asking, at what point does your urologist recommend ultrasound wave therapy? It's a great question. So I tell anyone that feels like they're having decreased quality of erections, they're a great candidate. All the way up to the point, if you're someone, again, that Viagra or Cialis was working and it's no longer working at all, it's important just to understand expectations. I think it will get the medication probably working better so that you can rely on it again, but it's probably not going to get you where you're totally off of it. Now, I've had some patients that did, but that's not the typical. But I think for the average patient that uses Viagra, Cialis, or is starting to feel like that's what they need, if they want to avoid medications, this is a way to go for those people. So again, mild to moderate ED. All right. This just goes through kind of what I was mentioning earlier. We're the first group of urologists in the Cincinnati area. I think we're still the only one that offers this therapy. We try to make sure when you see one of our men's health specialists, it's Melissa Helton and Mary Garrett. It's a free consultation to have that conversation with them about this so they can get into details of your specific situation. I think what's important is if we don't feel like this is the best thing for you, to have someone tell you that, right? That it's like, I think this is probably a waste of your time. Let's get you to a different advanced therapy, or here's your options. Or, hey, maybe this is the best thing for you. I don't think you need injection therapy that we're going to mention in a minute, because I think this is going to work for you and can reverse those things, since your goal is also to lose a little bit of weight and, other things. So it's more of a customized plan. So I think that's the big thing that makes getting this therapy from a urologist different than some of the other groups out there that are offering it. All right. If you're interested, again, you can QR code this or just give us a call. Ultrasound therapy is fairly easy. You can talk to your urologist about this if you have someone that you see in our group, but you can also just call our group and say you're interested in doing the treatment, or use the QR code that you see on here. If you use your phone up to it, it'll bring up the website. And they'll go through some questions for you they can answer, and then someone will probably call you either tomorrow or early next week, and they'll get you scheduled for, again, a free consultation to determine whether it makes the most sense for you. All right. Next treatment option would be injection, or as I tell people, injection therapy. And yes, this is something where you would inject yourself or have someone inject for you at home. It's pretty successful. About 60% of men are successful with it. Now, that being said, I'd say a higher amount of that it works in. It's just a lot of people will decide later it's not for them for different reasons. A lot of it is just because they don't like the idea of needles or having to do the injection every time. So what is it? So basically, you get a medication that's a compounded sterile medication from a compounding pharmacy. We would order it for you. And you would inject a medication at a certain dose into the side of the penis. When I say that, most of my patients, get real wide-eyed, like, you're going to ask me to do what? And it's not near as bad as it sounds. But if this is your penis, we have you inject onto the sides, not the top or bottom, but along the sides where there just aren't a lot of nerve fibers. We also utilize a needle that's pretty short. It's what we use for like diabetes or TB, if you ever had a TB injection. They're very small and short. And so we use that to inject on the side of the penis. That injections should take maybe 2 seconds, if that. And then you wait about 15 minutes, 10 to 15 minutes, and the medicine at that point should work. And remember how I said when you take a pill, you still need stimulation for it to work? That's what's different about this one. It doesn't matter. Within about 10 to 15 minutes, if we have the right dose, you're going to get an erection. That's the goal. So if you give yourself an injection and then something happens and the mood's off and things are interrupted, that doesn't matter. You're still going to get an erection, even if you're sitting by grandma. So that's what's good and bad about this one. Reasons that it's good, I think, is you don't have to take a pill. So again, it's easier to time because it's so quick. It becomes pretty reliable once you know what the medication does and you get dosed appropriately. You can kind of predict that it's going to be that way every time. What else? It's not surgical. It can leave a little bit of bruising. Most of the time it doesn't, but if you were to hit a little vessel, it can. But most people get used to doing that. Again, it can be your spouse or significant other can do the injection if you're not able to. But those same things I just mentioned are also why it doesn't work out as well for some people. If they don't have the dexterity, like to write, you may have trouble giving yourself an injection, or if your significant other doesn't like needles, they're not going to want to do that. It can be a little uncomfortable, especially for a lot of people. It's just the idea of it doesn't work for them. We always warn everyone, if you're giving yourself injections frequently, to alternate sides, because if you keep injecting yourself in the same area, you can get scar tissue. Just like if you give blood all the time in the same vein, you can get a little scar tissue. So that would be common. If you overdose or did it incorrectly, you could have an erection that lasts too long. Again, there's the risk of priapism. So that's a serious thing we talk about. Blood collection under the skin, again, that's like a hematoma where you may hit a little vessel and you get some bruising. It doesn't usually cause any problems, but obviously no one really wants bruising. And sometimes we have trouble with dosing. I have some patients that can't get the right dose. We can't get them high enough without making it too risky for the medication, that we can't basically get them where they need to be to have enough rigidity for erections and last long enough, but not too long. So it's a balance. Again, this kind of shows that we're injecting on the side. It usually works in about 10 to 15 minutes. The medication, also an important thing, typically needs to be refrigerated or frozen. It comes from a compounding pharmacy. There's not very many of them in the Cincinnati area that does it. We do have some mail order pharmacies from out of state that we also utilize. But once you get it, it has a shelf life that's prolonged by staying cold in the freezer, but it still is typically 30 to 90 days, depending on where you get it from. And after that, it's not that it's going to hurt you, it just stops working as well. So that's one thing, especially if you travel. I have some patients that travel with it in coolers or on dry ice. or have it shipped to their home in Florida if they live there half the time. Those are the type of things you have to think about. All right. And then the next one is implants. So this is an option that I have young guys talk to me about, all the way to guys in their 90s. So a lot of people will say, well, people don't really get that, do they? And it's like, oh, yes, it is an option for everybody if you're ready for it. So it's not usually surgery is not the first thing I offer my 40-year-olds that come in that's never tried a pill, right? We try alternatives, but this for many people is what they would prefer and makes the most sense for their lifestyle. So I'd say of my men that get surgery, we like to quote about 9 out of 10 people, or 90% of people, are very happy with moving on with surgical options. All right, so reasons why we wouldn't want to do this. Well, before I get into that, let me just show you. I'm going to skip ahead here. And then maybe we can go back to the downsides of it. So we have a couple different options for implants. The most common one, I would say, is an inflatable device. So again, typically 2 cylinders. You'll see it in this picture. And then what I have here, a pump that sits in the scrotum, and a reservoir that holds fluid that sits in the pelvis or behind the abdominal muscles. It just kind of depends on the person. And the idea is anytime you want to be sexually active, you would basically inflate these 2 devices. So I can push the button and it cycles the fluid out of the reservoir into the device, and it makes it rigid. Now, I'm not going to do it all the way up, but it can get as rigid as you want. I've never had someone complain that it wasn't rigid enough unless they weren't understanding how to pump it up. So, which isn't difficult. We just sometimes have to, go through it a couple times. So this is an inflatable device. The other option is a malleable. And basically, if you had 2 of these, I don't have one with me, I should have brought one, but 2 malleable devices that fit in, that are cylinders that basically bend up and bend down. And they don't inflate or anything. They don't change size, width, or length, but they are rigid enough that they'll keep their form and you can have sex with it. Some people like that because it is simpler. There's less parts, so a little less likely to break down over time. For those that have a hard time with a pump and pushing the fluid and deflating, they don't have to worry about that. I've had patients that's had these for years and were really, really happy, but they needed a device change because maybe they had it so long that it had stopped working, and they decided to go with the malleable because they were at a point in their life they're like, I just want the simpler option. So I'm going to go back a slide here, and it's like, why to seek alternatives? Well, it's a surgery, right? So this is not risk-free. I mentioned our shockwave therapy is basically risk-free. It costs money, but otherwise the risk of injury or pain or discomfort or time out of work, all those things are minimal. The opposite is true for surgery. So it's typically outpatient. It's rare that someone needs to stay overnight. Usually this is done with 1 or 2 incisions, depending on which surgery you decide you're getting. Sometimes you can go at home with a drain or a catheter, many times not. But because we're putting in an implant or a device like this, it's a foreign body. And the issues that people have with foreign bodies is, well, they can get infected. So we have to be very cautious to make sure people have their diabetes controlled, if that's a concern, to make sure you don't have any infections when you come in on your skin, and that you take care of the skin and you do all the right things during the recovery process to minimize those risks for infection. If it were to get infected, we'd have to take the device out. And that's always important to know, because sometimes it's not so easy to put one right back in. We typically can, but not always, and sometimes you have to wait for a while. The other thing is that these devices can fail. So just like anything else that has moving parts, over time, these can break. So if a part of this were to break or fail after so many years, then we would have to typically take out the entire thing and put a new one in, which we can do, and we do that as needed. But that's just one of the downsides to it. And then there's also the risks of surgery just like with anything else, whether you have a mole removed off your face or you have open heart surgery, there's different levels of risk with surgery. And again, this is outpatient. We typically make sure we're checking all the boxes and make sure you're an appropriate surgical candidate before we're offering it to you. But it is a good option for those people that especially either the medications aren't working or they're tired of dealing with the side effects of it, or they get tired of doing injection therapy, or they want to skip all that and just go straight to surgery because they know that's what makes the most sense for them. All right, I show these pictures. So I believe we have a video next that we'll go through just to kind of make sense of this one more time. So again, that blue up in the pelvis is the cylinder that holds the fluid. The two cylinders are in the penis, and then you have a reservoir. He is squeezing the pump, which moves the fluid out of the reservoir and into those cylinders. That is not painful at all once you're healed. It sits close to the testicles, but not part of it, so you're not having to squeeze the testicles or anything like that. Obviously, no one would want to have surgery or a product like this if that was the case. And then there's a button right above where he pumped it up to push, and that lets the fluid leave the device and go back into the reservoir. Okay. All right. Well, I made it through all of my slides, so I'm hoping that gave you a little bit of background of maybe why you could have some level of erectile dysfunction, what are some of the causes for it, and what the typical treatments can be that we talk about with our patients. I know some of you had some questions. I want to make sure I'm answering them because they've kind of accumulated here. Someone was asking about dosing of Viagra. So 40 milligram dose of Viagra that gets an erection but doesn't maintain the erection during intercourse. Should you increase the dosage? And if so, is there an issue to other organs in your body? That's a great question. So if you are using 40 milligrams of Viagra, and remember I said Viagra has the highest dose is 100. If you are getting an erection but it's not maintaining, I think you're totally fine to go up. So if you're taking, let's say those 20 milligram small tabs, I would go up to 60 milligrams. So add another one and try it with that. And if that doesn't work, not the same day, make sure you try it on a different day, try going up to 80. You are completely fine unless your doctor has specifically told you not to do it. You are totally fine going up to 100 milligrams of Viagra. That is the max dose, but that is a safe dose. I don't have any patient that I say it's not safe to go up on unless there's some specific thing about your history or your cardiologist has said, you can't go up so high. I just typically tell patients don't start at 100, start lower just to make sure you understand what side effects you might have. Like if you're someone that gets really bad headaches with it, we don't want you to start with a high dose and have a worse headache than you really need to have. But yes, I think it's fine to typically go up. Let's see here. Is the max treatment 6? No. I would say the minimum treatment should be 6. That's typically a full treatment cycle. After that, the question is do you need more, and how often if you do? We like to really use our medical studies that people have done to help give us suggestions or recommendations. Unfortunately, it's not real clear how long this lasts or how often you should have it done. So I have some of my patients that after they get through the 6, they do a once a month maintenance to maintain it because they feel like that's what's given them the best results. We have some that just kind of wait till their symptoms start coming back. For some, it may be in a couple months, and others, it may be a year or more. It kind of depends on what your lifestyle is out, when you're not here getting treatments. And what I mean by that is if you are someone that maybe hasn't been exercising lately, you've gained a little bit of weight, and you came in and did these treatments, and you also started to exercise, try to lose some weight, be healthier, and you did this, maybe you don't need treatment again for a long time. Maybe you go back to your old ways, though. Then you may need to start doing maintenance treatments or get another treatment, 6 of them again, maybe because it's 6 months to 12 months later. So I tell people it depends on what you're doing with your body otherwise. If you are doing something to maintain what you just gained from this treatment with ultrasound to increase blood flow, then great. If you're doing that to maintain it, you may not need something else. But if you're someone that continues to maybe keep your blood sugars high or have high blood pressure and not exercise, then you're not doing anything to maintain that increased blood flow. So you may have to do this artificially by using ultrasound and doing it that way. So it kind of just depends on what your outside activities are and daily living activities. Do you need maintenance treatments for shockwave every few years or so? Exactly that. It may be every few years. It may be so many months down the road, or you may just choose to not wait until you have symptoms again and do a monthly maintenance. Do the injections work when pills no longer work? That's a good question because I don't think I explained that very well. I have a few patients that go straight to injections, but typically they're trying pills. Most of my patients try pills first. It's the thing that they're most familiar with. They've heard about it maybe from their family doctor or their friends talking about it. So we try that. If they have side effects or the dose that I can offer them in pills just isn't cutting it, that's usually when they go to injections. The way I look at it is injections are stronger than pills. So you can get a lot more out of injections than you can just the pills. Someone asked how long the erection lasts. I'm not sure what that was referring to as far as treatment. The pills usually last, again, for about an hour. If it's Viagra, a day and a half if it's Cialis or the generic versions of those. If it's the pump, it's as long as you leave the band around it. If it's ultrasound therapy, it just depends on how your natural erection lasts. And if it's injection therapy, which may be the question you're asking, it depends on the dose. My goal is that the erection lasts an hour to hour and a half. Unless you've orgasmed and you're done, then it may, go off quicker than that. But otherwise, that's about our goal. If it's lasting longer than that, I get a little bit hesitant. We may want to try to decrease the dose. If it's not lasting that long, it's usually okay to go higher if the patient feels like they need to. Actually, next question. How long does it go away after you climax? Partially, yes, or totally it might. But with the medication still in, if it's in the next hour and a half, you probably can get the next erection more easily than you had if you had not had the medication in your system. But otherwise, it usually partially goes away. Does some fluid always stay in the device? Good question. So this is partially inflated. I didn't inflate it all the way. When I push the button on this device, it starts sending the fluid out. And if I squeeze it, it'll send it out even faster. I tell some of my patients really like it completely deflated. They do not want to feel like there's any fluid left in those cylinders. So I tell them just go ahead and squeeze around the penis a little bit longer, just gently and push down. And you can really get these where there's nothing in it. So it just looks like a flaccid penis. I have other patients that like that feeling of having it partially, I don't want to say partially erect, but to some degree, yes. And for those of you that are older, I'll say this, okay? For those of you that are older and you feel like you've lost length, not just in your erection, but in your penis in general, and typically I'll say it's because the skin is starting to come down over the penis. Your penis is locked in with a tendon on your pubic bone, so it can't go anywhere. So I promise that flaccid penis is not getting any shorter. I get that question every day. I'm in office. But what happens, just like in women or men, it doesn't matter. Gravity is against us and it pulls skin and tissue down. And when it does that, it starts covering the penis, right? So you're starting to get the hood and the glove and everything over the penis and it's starting to become hidden. So for my patients that have that, a lot of times they like leaving this partially filled because it gives them a little something more to hold on to when they pee. And it makes it push out from the foreskin. So we have a lot of patients that like this just for that reason, or they choose a malleable, not just for ED reasons, but because of that. They have a hard time reaching the penis, holding on to it, not spraying when they pee. For all of you young guys that are out there, I know you're thinking, what? That really happens? It will. It does. Unfortunately, right? Things happen to all of us as we age. But that is an option, again, with the malleable or this. How long does the device last? A great question. So average life expectancy with these that have been around for a while is 7 to 8 years. Again, 7-8, not 78. Their devices, they break. I have replaced one before after a year. Just like a car, you can get a lemon. That's pretty darn uncommon. That has happened very rarely. I've also seen them last 20 years. I've seen patients that, they had them put in before I was here practicing urology, and they are still functioning just fine. So they can work over 20 years, but the average is probably 7 to 8 years. So if you're a guy that's, 60 years old, potentially even 70 or younger, when you do this, you may have to think, well, at some point I may need a revision. I'm going to need another one. I'm usually very clear with my patients to remember that because they may not last forever. Does the fluid ever leak and need replaced? That would be considered a malfunction. Once it leaks, I can't put it back in. The good part of it is, when people are always worried about things leaking, is what's in this is injectable saline. So it's the same stuff that we give you in your IV if you need fluid replacement. So it's very safe. There's nothing concerning about it. But once it leaks out, you need to have a new device. Now that brings up another question though. A lot of my guys, maybe when it fails, are older and they're not at the point they're sexually active anymore. And they say, do you have to take it out? No. If it's not causing you problems, it's not hurting, there's no signs of infection, then they do not have to come out. You just stop using it. It's fine. And it can stay in place. But if you want to have it removed, certainly can. All right. There is a pop-up on your window that's asking you about, take a quiz, and feel free to take that. It'll give you a score of what your severity of ED is. So it's just one of those things that's kind of insightful and good to know. And certainly it's a good thing to bring up if you end up seeing your urologist or if you call in for a consultation with one of our sexual wellness specialists. It's a good thing to mention, that you took that and those are what your concerns are. If anyone else has any questions, I'm happy to answer them. Make sure I haven't missed any. Someone asked about the cost of the ultrasound therapy. I missed that one. And I don't want to be wrong on this because I know there's definitely discounts if you do more, purchase more upfront than if you just get 6 of them. But they typically range between $2,000 and $2,400 for a treatment of 6. And then you get significant savings for maintenances down the road, or if you buy in packages. I think you can use it with your HSA, FSA, but again, insurance doesn't cover it. That's the downside. I'm waiting for insurance to cover it. I think that'll be great for our patients once it does, but that may be years from now. We have not heard anything likewise right now for our region that Medicare or private insurances are going to cover it. All right. Another question. Why do you offer penile implants from different manufacturers? Boston Scientific is used by your firm as well. You are right. So there are 2 traditional companies that have offered devices. One is Coloplast and one is Boston Scientific. They are both very reputable, have been around a long time. I've implanted both companies before. There are slight differences in their implants, and I think a lot of surgeons tend to prefer one over the other based on their training and what their experience is. I think some of us think that some of the pumps are easier to use than others. It also depends on the shape of the penis, what your goals are, those type of things. Does someone have Peyronie's disease versus do they not? So everybody's a little bit different in what they choose, but yes, there's two. And there's actually a new company out there that has a malleable option that I've implanted and I really like. And I do think they're going to come up with an inflatable device eventually. You know, more competition, the better. It helps people improve their products, have better results, and keep prices down. So in the future, hopefully we'll have another company. Other question, how do you know if your daily dose of Cialis is better than a larger dose of Viagra used for occasional use? I would try both. It depends on what makes the most sense for you, right? So if you're someone that's like, I can't plan sex, it happens on the spur of the minute, and I don't have it planned, and it's not always just on Friday night, or it's I'm pretty active and 5 days out of the week I'm having sex. Well, then, I tend to tell people go with the low dose Cialis or tadalafil, because then you don't have to worry about it. It's always in your system. You're good to go. If you're someone that has sex not that commonly, or it's just on date night and that happens once a month or once a week, then maybe it's easier not to be in your system and just do the Viagra, especially if you have side effects. Maybe you do get a little congested. It doesn't bother you that bad. You're willing to take it. Then I would just use it as needed. But I've had patients that have tried both, not at the same time. That's a different discussion. We traditionally don't tell people to take the medications at the same time. But to try Viagra as needed, and then at a different time for maybe a couple weeks, try the daily Cialis. I think if it was me, I would encourage you to try both. That way you know what works the best for you. Okay. I don't see any other questions coming up. So I appreciate all of you all joining me tonight. This is recorded, so you'll be emailed a copy of this webinar today or tomorrow probably, so that you can watch it again. If you have a spouse or significant other that you think would benefit from seeing it, then I highly encourage you watching it. I tell a lot of my patients, I have guys that come in that's thinking about a penile prosthesis, and I say, have you talked to your significant other about this? And they look at me like, no, but I need to. And I'm like, yes, you do need to. It's not something you want to necessarily surprise them with. But if you're afraid to talk to them, or it just doesn't come easy, I tell them, hey, tell them I said it was your homework. Get them in and say, Dr. Edwards, or I watched this, or I saw her in the office the other day and she said I needed to watch this with you. It is so much better to have both people on board and on the same page versus trying to do it on your own and then maybe catching them off guard or them not understanding the effort that you're putting in. So a lot of times this is a way to break the ice and start the conversation and let them know where you are with this. So anyway, I just wanted to add that in because I think that is important for a lot of people that may be in long-term relationships, and things have changed over the years and you don't know really where to start or where to talk through things. So anyway, thank you for joining us. I very much appreciate your attention. Hopefully you got something from it and hope to see you in the office one day. All right, take care.